It is no exaggeration when we say that cancer is one of the most dreaded and feared diseases in the world today. So in today's episode of Let's Talk Life with AIA, we are going to take a deep dive into this subject and explore questions like how can the early detection of cancer help prevent the disease? And what kind of common misconceptions are there about this disease in society today? And of course, what impact does our lifestyle and lifestyle choices have in the prevention and detection of cancer? So, to discuss all these in greater detail, we have in the studio today with us the consultant clinical oncologist at the National Cancer Institute, Dr. N. Jeyakumaran. So doctor, we are made aware about cancer starting from a very young age, and we know that it's everywhere in the world and society, and that we have to somehow live a lifestyle that does not cause cancer. So before we get deeper into the discussion, could you maybe start us off with what is the definition of cancer in a medical perspective?
Yes, as you said, the people are fear of the word about cancer. But cancer means it's actually a Latin term for crab. That means the heart center with the claw-like projections coming out like in crab. You know that in our body is made up of billions and billions of cells. And they are under strict regulatory process and under control. These cells are being formed and maintained in a static number. But sometimes due to the exposure to some carcinogens, some cells get changed at the DNA level, and when the DNA changes, that regulatory mechanisms all go out of control. So the cells start dividing without much control, without the purpose and so on, and then make a lump-like things. And it also has the capacity to spread to nearby organs or nearby lymph nodes, and it can even spread throughout the body and make the person very ill and so on. So altogether, this sort of abnormal production or abnormal multiplication of the cells without much purpose is called cancer.
So if we can discuss, okay, we talked about how cancer can occur in any part of the body. We all know in society today there are certain causes of cancer, smoking being one of the main primary causes. But can we go a little beyond the known aspects and talk about what kind of causes can lead to cancer?
Yes, because cancers are caused by physical carcinogens or chemical carcinogens or viruses and bacteria. But physical carcinogens means mostly the radiation and any other like electromagnetic waves even. The radiation is known to cause cancer. The evidences are like, you know, that when this Japanese bomb blast or the atomic bomb, after the atomic bomb blast, the survivors had a lot of cancers, and then Chernobyl accident in Russia, a lot of people developed cancers following the radioactive iodine fallout. Similar way that those who work with the radiation and radiotherapy or radiological department also, people are high chance to get cancer. So radiation can cause cancer. These are some bit of physical carcinogens. Similarly, the sun ray under the sun, when you are going, you are also exposed to ultraviolet A and B. Ultraviolet B is a little bit bad than the ultraviolet A. That can cause skin cancer, especially in the white skin people, but we are a bit safe because of the presence of melanin in our body. Similarly, the chemical carcinogens are also there. We are exposed to most of the chemicals, like when you smoke, even after the burning of the cigarettes or cigars or BD, the smoke has got a lot of chemicals. It's especially in the smoke itself has a lot of chemicals. It goes to the lung as well as it can be after going to the lung, it can mix with the blood and it can spread to exposed to all of the organs. So smoke also has got a lot of chemicals which have carcinogenic property. Similarly, alcohol also has the chemical nature itself, has burning effect and chemical effect, and also its chemical nature also can be a carcinogenic material. Other than that, betel nut chewing plus areca nut also has a lot of nitrosamine containing products. And the smokeless tobacco also, they chew with the betel, areca nut and then lime and so on. So these all together has carcinogenic effect to the oral cavity and so on. That's why we are having a lot of oral cancer among males who do chew betel nut and smokeless tobacco and so on. Other than that, in our agriculture setting also, a lot of pesticides they are using, ad hocly they are harvesting, so they are not waiting for the pre-harvest interval time. So end of the day you will get chemicals remaining in the harvest. So we are eating those and slowly we are being poisoned, and that also can cause cancer. And those who are working with chemicals other than the pesticides, and whatever forms, if you are not properly adhering these preventive aspects, like for example even tinkering, when you say for the car and so on, you have to have a strict regulation of having it in a confined area and do that. But people are not caring about those regulations, so it's exposed to most of the people and they are inhaling. So these chemicals, whatever form, it may pollute the air and that we may be inhaling, and it may go into the food which we may eat, that may go into the water stream and which we are drinking.
Doctor, I also wanted to ask about how cancer can also be genetic, right? Like it can come from your family, like a past family history of cancer. Hereditary incidents of cancer are also common in society, is it?
It's not common because most of the time cancer do occur in the older age group people, but still you may come across young age people like around 35-40 years old females getting breast cancer, or some people getting leukemia or blood cancer, and these are related to a little bit with the familial or genetic relationship. That is because if the cancer is caused through damaging the DNA of our cells. So whenever our DNA is damaged by these carcinogens, we are having a mechanism to repair the DNA and make it in a correct position and correct shape and so on. But still some have defects in the repairing mechanisms or repairing enzymes and so on, and also some are having their DNA in such a manner that they are easily this DNA can be damaged by these carcinogens. If it gets damaged, that DNA is getting changed and it will work in a different manner, and the cells will multiply in out of control and so on. That's why people are getting those who are having defects in the genetic defects. For example, if the breast cancer, BRCA1, BRCA2 genes are, they are proto-onco genes. The proto-onco genes means that gene, if they are having the chance to have breast cancer more often. Like for example, BRCA1 is the abnormality in the chromosome 17 and BRCA2 is an abnormality in the chromosome 13. So if they are having this sort of BRCA1 defect or BRCA2 oncogene presence, they are more prone to get breast cancer. That's why nowadays the familially occurring, if the family member who is having a cancer at a young age, the children also can check for this BRCA1, BRCA2 gene. If they check and if it is positive, they can go for prophylactic bilateral mastectomy. That means removal of the both breasts, and they can reconstruct the breasts as well beforehand, so that they can prevent the breast cancer occurring them. At the same time, BRCA1 gene has the high chance to develop ovarian cancer also. Then they advise them to complete the family before 35 years and so on, and they also remove both the ovaries as well before 35 years and so on. There are some ways and means there to stop getting these cancers if you find it early, or else you can check them early about occurring the cancer at early stage and so on. Other than that, some leukemias can occur beforehand. There are some gene abnormalities in the chromosome. There may be some changes or some translocations. These can happen, but these familial or genetic ones are not common. It may be around 10% to 15%, not more than that. But most of the things are due to carcinogenic exposure, which we are having it in our environment. It may be what we are drinking, what we are inhaling, what we are eating and so on, and also plus sedentary life and not doing exercise, not being physically fit and so on. Those are the main reasons that we are getting cancers. Mostly it's occurring in the urban society. If you see in the village society or the village side, people are working and they are getting the fresh air, fresh food and the fresh water, and they are all the time in the move. That means they are doing a lot of physical activity and for their earnings and everything related to manual works and so on. And they do involve in physical games, not like here in the city where they are mostly with the computer games and they are sitting inside some apartments or something like that, and busy life and stress and so on. So mainly you have to remember that familial or the genetic related cancers are very few.
So doctor, when we talk about Sri Lanka, what are the current statistics about cancer prevalence in Sri Lanka, and how is our country affected by cancer?
Yes, in Sri Lanka, we are having cancer registries. National Cancer Control Program of Sri Lanka is maintaining these cancer registries annually. So during the last 5 years, cancer registries reveals that among males, the most common cancer is oropharyngeal cancer. Second common is lung cancer, and third common colorectal cancer. But among females, the commonest is breast cancer, the second common cancer is thyroid cancer, and third common cancer again, like in males, it's colorectal cancer. But before 5 years, that means from 10 years to 10 years back to 5 years from then, the colorectal cancer was around 6th or 7th rank, but now it's coming up as the third common cancer among male and female. This is big change. This may be due to our lifestyle changes, and we may be having more obesity. Even obesity in the adolescents, even you can see in Sri Lanka. And other food habits about junk foods or the fat diets more consumed by the youngsters as well as the young crowd. So this may be the cause for colorectal cancer coming up. That also we have to think about it. But worldwide, if you see compared to Sri Lanka, the commonest cancer among males is prostate cancer and then lung cancer. But females, the breast cancer is the most common. But second common cancer may be colorectal cancer and so on. Because in Western countries, mostly the smoking related cancer, so lung cancer is coming up, and the deaths due to lung cancer also more common in West. But here in our setting, males are mostly having oropharyngeal cancers, mainly because of the betel nut chewing and so on. Yes.
In Sri Lanka, what are like the most identifiable types of cancer, and why are we seeing a prevalence of it, like you said?
Yes, because as I said earlier, among males, oropharyngeal cancer is the more common. This is because of their habits related to chewing betel, smokeless tobacco, and arak nut. And also not only that, they smoke a lot and consume alcohol. Alcohol in the sense maybe even other illicit alcohol and so on can cause the damage to the oral cavity and epithelium of the oral cavity and the pharynx also. So they are getting more cancers. And in the oropharyngeal cancer nowadays the presence of HPV virus also one of the risk factor. The second common cancer is lung among males, that is due to the smoking. It can be cigarette or BD or cigar or even passive smoking. Because those who are not smoking, even if they are with the smokers, they may consume the smoke that is produced by the smokers. And then asbestos also one of the reason, and here the Sri Lankan government tried to ban that, but it didn't work out, and now still they are continuing the use of asbestos. But still the sheets, asbestos free sheets are being produced for those who are willing to buy that with a higher price and so on. And not only that, air pollution due to the factory air pollutions and so on. Here in our country, we are not having the exact territory of different residential territory and industrial territories for the people to have those things. But in Singapore and so on, if you think that it's a small country, so they are very strict in having residential area, industrial area and other areas separately, so that the environmental pollution will be minimal. But here we are not having that. And among females, the breast cancer is the common cancer. This may be due to the late marriages, also one of the reason, and not having many children, and other thing as we discussed earlier, familial or the genetically related breast cancers, and some hormones consumption even in the meat or other things that can also influence, because estrogen related cancer. And other thing is high fat diet and less exercise. All these contribute to breast cancer. Second common cancer among male is nowadays it's thyroid. It's for two reasons. One is more detection, because nowadays everywhere the ultrasonographic investigation is available. So whenever small lump is there in the neck, they go for scanning and do investigate and find it more cases. And the third common cancer among male and females, as I said earlier, colorectal cancer, which is mostly related to the less exercise and obesity, high fat diet. These are the causes for colorectal cancer. This may be due to our food habits and behavior. And other thing is, this also again has the familial tendency if they are getting at young age group. So this is the current situation in Sri Lanka. Yes.
So is there a way that we can, or are there ways that we can detect cancer early without, I mean, it could mean going to a clinic and doing tests and finding out, or it could simply be something that you do at home. What kind of ways do we have to detect cancer?
Yes, cancer we need to detect early, because if you detect early, you can offer a curative treatment. So there are, for the common cancers, we try to detect the cancers early, and there are many programs also available in Sri Lanka. The issue is, for example, if breast cancer, the women can have self-breast examination at a particular time after the menses or something monthly. When they feel their breast and having their breast awareness about their breast, so they will, if they have some suspicious lumpiness or any lumps, if they feel it, they have to go and meet the doctor. Similarly, there are some programs of after 40 years, you can have mammogram for the breast cancer detection or ultrasonographic detection. And also for females, cervical cancer, if they have any bleeding or irregular bleeding and unusual any discharges per vagina, so they also have to see the doctor early. Then there are ways of detecting the cancers early. That means by pap smear examination or by colposcopic examination, they can detect the cancer early. And for example, among males, oral cancers are the more common cancer. That also again, they can see their oral cavity in the mirror, and see any abnormality or if any wounds that is not healing. Also they have to detect early, because they can see a doctor and see whether that is cancer or not, like that. And if the cough is there for a long time, still they can do some x-rays and see whether lung cancer possibilities are there. So early detection and screening methods are available for common cancers in Sri Lanka, because that is cost effective, and you can target some population who are at high risk. That means who are exposed to more carcinogens. So you better, for example, oral cancers, those who are betel nut chewers, you may call them and examine and to help them.
And when you detect cancer,
Yeah.
let's say at an early stage, what are the chances that you can prevent it or eradicate that cancer?
Yes, it's a good question in the sense, because in females, cervical cancer, for example, if you detect the cancer early, we have the pre-cancerous stages, that is called CAN 1, 2, 3, like even before cancer occurs, there are some stages which is, if they are having that stage, if you don't intervene, it will lead to cancer. So if you detect that, you can remove that part and advise them, and then they will get rid of the cancer. So that is a good thing. Similarly, in the oral cancer also, there are white patches and this red patches. Those are called leukoplakia and erythroplakia. So what happens is that also, if you detect early, you can ask them to stop all the risk factors like betel nut chewing, smoking, alcohol consumption, and so on. So it will be reverted. That means they will not proceed to get the cancer. So these are good things to stop the cancer occurrence. And other thing is, for the cervical cancer, now there are programs for vaccinating. As I earlier mentioned, human papillomavirus vaccines are available, and it's being given in the school children, among the school children at 12 to 13 years, 2 doses, 6 months apart, to cover the human papillomavirus 16 and 18 subtypes. So because these two subtypes are causing 90% of the time the cervical cancer at the womb, so then they won't get even the precancerous stages. And also you can do some HPV DNA testing. If it is positive also, you can take care of them and prevent them having the cancer in future. So, and mammography is there to detect the breast cancer early. Otherwise, if you feel and detect the lump, it will be a little bit late. But even if you can't feel the lump in the breast, but around 40 years onwards, you can do the mammogram and see 3 yearly, like that. Because before 40 we are not advising to do mammogram, because before 40 years the women's breast is a little bit denser, because when it is denser, the mammograph will be also mostly whitish thing, and then the tumor can't be seen clearly. So, but after 40 years, you can do mammogram as well as ultrasonographic examination of the breast, so that you can detect the cancer early. And then, but before 40 years, if you are very suspicious of having any lump in the breast, you may do MRI. That is very rarely we are doing, not frequently we are doing. So in women, we are having the program of mammography, ultrasonography, as well as for cervical cancer, we are having the pap smear program, as well as HPV testing program, and also vaccination program for the young girls at 12 to 13 years. And males, we do examine the oral cavity if they are having the habit of betel nut chewing and so on. But for lung cancer throughout the world, we are not having a set program of early detection. But accidentally, or for the medical checkups, if they do the chest x-rays and if they find it, they may get a little bit early. Otherwise, when they develop symptoms only, we are getting those cases. So these are the programs available at present in Sri Lanka, yes.
So, doctor, what are the conditions and causes associated with cancer in young children?
Yes, young children in the sense nowadays in Sri Lanka we are having a separate pediatric oncology department, but still that number per year is not very high, around a maximum of 800 new cancers are being detected per year. But the common cancers among children are like hematological malignancy, there is blood cancer and lymph node cancers, those are called hematological malignancy. Second common cancers are brain tumors, and then comes the sarcomas and bone tumors like osteosarcoma, like that. But when the children are getting hematological malignancy, nowadays more than 80% success, the survival advantage is being made by tailored treatment options that are available at present. So they do well. Then brain tumor also, there are different types of brain tumor, the better types and low risk tumors with surgery plus radiotherapy, they are living long. But then comes the about adolescence time, mostly they are getting sarcomas and osteosarcoma around the knee joint and so on. If they have any knee joint swelling, they have to see the doctor or surgeon first as early as possible, rather than delaying the treatment, because when they delay they may come with metastatic state, that means spread it to the lungs and so on. So if they find some limb swelling or around the knee joint or anywhere in the bone is swelling, so they have to see the doctor or consultant surgeons early, so that they will be detected early, so that they can even preserve their limb and cure them. So mostly the children's cancers, most of the time now, as specialized units are there in Sri Lanka, they are doing well, as well as they respond to treatment well. But still they say emotional component is there, because as they are young age group and with the family of the parents also young people, and they are emotionally very upset, and so you have to tackle them very holistic manner and treat them in a regularly and long term treatment they are getting. For example, hematological malignancies, around 2 to 3 years of treatment is there, without much defaulting they have to have it. But there are supportive facilities are also available in Sri Lanka for them to stay at hospital and get the treatment as in a homely environment and so on. Yes.
Doctor, we know that there are treatments to cancer, but could you elaborate on what kind of treatments are available for cancer patients?
But it's very important to tell about treatment, because most of the time in the society people are asking, doctor, whether have they found treatment for cancers? Still not no. Like that only they are thinking that there's no treatment for cancer as such. But still, you have to remember there are so many treatment options available to treat the cancers, and even we can cure many cancers. If you detect cancers in early stages, we can offer local treatment like surgery or radiotherapy. But if it's spreaded manner, if you are finding the cancer in a person, you have to offer systemic treatment like chemotherapy with the medicines, and then immunotherapy also available for that state, plus hormone treatment and so on available. But we encourage people to not to have cancers if they adhere good quality of life and so on. But still, if they have come across cancer, they have to find the cancer bit early, so that we can offer a curative treatment with one or two modality like surgery plus radiotherapy, which are not having much side effects, less costly and so on. But if the people come with late stages and a little bit spread stage, that is stage 4, stage 3, like that, we need to start with chemotherapy, which are very expensive and which will cause a lot of side effects to the people, and the immunotherapy all are very, very expensive, and that also we are giving in the late stage cancers. And so These are the main treatment options available, but we all are having this in our hospitals. In all the provinces, we have a center of excellence for cancer treatment. So they all provide this all type of treatments free of charge. But still people sometimes default because they may go to some other alternative treatment options, and they come again in a late stages. So when you come to hospitals for these treatments, you have to follow the doctor's advice and regularly come and visit and complete the treatment, and even you have to visit for your surveillance period also, because to avoid any further complications of the treatment, as well as to get the early recurrences identification and so on. Yes.
Now, we've talked about treatments, we've talked about the kind of cancers that are there, and we all know this is something that we need to avoid, which brings us to our last question for the day, is how can we prevent cancer? We all have heard this word or saying, prevention is better than cure. So we have the control of preventing this in our hands. So what things can we do in our lifestyles to help prevent cancer in the long run?
Yes, actually, really speaking, preventing cancer is the best. That means you have to avoid all the risk factors like the carcinogens that causes cancers. For example, the commonest cancer in Sri Lanka, the oropharyngeal cancer, is not common in the West because they are not having the habit of betel nut chewing. If you avoid the betel nut chewing and smokeless tobacco chewing, you can definitely avoid the oral cancer occurrence. And also you have to keep your mouth very clean, and you have to have a good oral hygiene. You have to visit to the dental surgeons or any other doctor and seek help to make your oral hygiene. Whenever even the bad teeth or a sharp teeth that can continuously irritate your mucosa of the oral cavity, that also can cause cancer in a long run. So this is for the males. And for the males to avoid the second common cancer, that is lung cancer, they have to stop smoking or be away from the smokers, because you may be the second-hand smoker. And then among females, breast cancer, you may have to have a good exercise and avoid these hormone-related foods, and also you may have to see your breast examination and go for mammography and ultrasonographic examination, so that you may detect early, so that you can cure them also. And as far as the cervical cancer is concerned, it's going down to fourth common cancer, because it may be because they are detecting at the precancerous stage, which is not in the statistics. So then also the children who are at 13 or 12 to 13 years have to have this vaccine against human papillomavirus, which will definitely reduce the occurrence of cervical cancer. And this thyroid cancer, because of the early detection and more detection, you are getting more cancers. Time to come, it may come down. And also you may have to reduce the salt intake, because our salt is iodized, and if you take more salt also, more iodine salt, iodine will also cause thyroid cancer. So you have to reduce the salt intake. That will reduce the thyroid cancer, as well as it will reduce the other non-communicable diseases like hypertension, ischemic heart disease, and so on. And other common cancer, which is the third common cancer among males and females, that is a colorectal cancer. That again you have to avoid a high fat diet and do regular exercises and keep your body mass index within normal limits, that means less than 23. And also you have to go for high fruit and high fiber diets that will have a good motion in you have to have a good motions and so on, so that you won't get much exposure of carcinogens in the bowel surface. And so finally, I would like to say as a take-home message that if you have a good environment, that means non-polluted air to breathe and good water to drink without much polluted by chemicals and so on, and good food to have with the high fiber diet and less fat diet and less chemical infiltrated or carcinogenic diet. Even you may encourage home gardening and have your own food at home, and also you do regular exercises, and during the work time or even whenever possible you can walk and use the stairs instead of lift, and do more physical games rather than the computer games and so on, and keep your body mass index below 23 and so on, and also be aware about cancer and be aware about the causes for cancer, and tell to others also to detect the cancer early so that we can offer curative treatment in the hospital, in the cancer hospitals of Sri Lanka. Even all the provinces, you are having a one center which is a center of excellence in each province, so you can even go and discuss about your suspicious things or lumps or any non-healing ulcers in your body or any irregular bleeding per rectum or irregular bleeding per vagina or any discharges if you come across, and hoarseness of voice or cough and so on. You have to see a doctor and try to rule out the cancer in your body, and be healthy and be cancer free, and try to detect cancer early for cure. Right. Thank you. Right.
So today we had an invaluable discussion about one of the most pressing health concerns that's affecting the world, cancer. And we had Dr. Jeyakumaran, who has shared his time, experience and wealth of knowledge with us on the subject to help us understand cancer and how to prevent it, how to detect it and how to beat it. So until we meet you again with a new episode of Let's Talk Life with AIA, we wish you a healthier, longer and better life. Thank you.